we talk about screening, again, for our viewers out there, what exactly does that mean when we say we're going to screen for something in a patient?
And that's an important question to understand, because screening is looking for a disease or condition in a person that doesn't have symptoms. And so oftentimes patients misunderstand what a screening test actually means. And it's important to understand what we're actually looking for. We don't expect symptoms in a screening exam.
Okay, so since there aren't any symptoms, like you said, and the screening happens, why are these tests then so important to become part of a regimen at a certain point in a patient's lifetime?
So screening tests are very important. Most of us who go into medicine do like having a cure for illnesses and conditions. But beyond that, honestly, it's better if we don't even have a condition to begin with, if we can prevent a condition, or if we can detect it early enough to have a successful treatment. And so, as they say, prevention is better than cure.
Absolutely. Okay, so screening is great in that end. Now, one question I have, sometimes we hear about screening and then maybe there are some results that come that might have been unintended, or you might hear words that might be confusing. So let's talk a little bit about that, about some of those, unintended consequences that might come from a screening.
And that's also important to understand, because there are consequences that come from screening tests. They can be as mild as discomfort related to an exam. It could be more serious, like risks related to a procedure that might be more invasive. We'll talk about a little bit more in detail false positive results, and also what we refer to as incidentalomas in the medical community, which are incidental findings that were not what the exam was looking for.